See, good health and nutrition are fundamental drivers for growth. Both economic growth as well as for physical growth. You know, uh, India has made remarkable improvement in every sphere. Unfortunately, malnutrition is something which is bothering the country, and we have not been able to make the kind of improvement that we made in many other sectors. Of course, it has many reasons, underlying ones, but we have to tackle this on war footing. Malnutrition has many, when you eat less and you have undernutrition, when you eat more than what is required, some people get into overnutrition, what we call as obesity, overweight, and the problem. In undernutrition, there is a kind of undernutrition called macronutrient deficiencies or vitamin and mineral deficiency. These are commonly, we know what is vitamin, mineral, like vitamin A, B, iron, calcium. These are called micronutrients because they are required in small quantities. And these come from the diet we eat. As our diet is getting narrower and narrower, and we are not eating a balanced diet or a diverse diet, many of us are deficient in essential vitamins and minerals. One way to tackle it is identify what food people are commonly eating, add that to the commonly eaten food. This is what is called food fortification, and mainly staple food fortification. A good example that has been successfully done globally and in India is adding iodine to salt. Now we all take iodized salt, that benefits. Like that, the other staple food that you can fortify are wheat flour, rice, edible oil, and in some countries they've even done sugar and other sources that they use. We normally used to think that these vitamins are all, if people are hungry, first give them food and then tackle this. This is a wrong idea. All have to go together. We know that vitamin and mineral deficiency by itself contributes substantially to the global burden of disease. So this has to be tackled, and that is why the country, India, has been running the vitamin mineral deficiency program for many years. India first started vitamin A supplementation national program, one of the first to start globally in 1967. We started an anemia control program in the early 70s. India is also the pioneer in salt ionization. The Kangra Valley study in 54 is what gave globally the idea about salt fortification and how iodized salt can eliminate iodine deficiency. We started fortifying vanaspati, the hydrogenated oil, by mandatory means as early as 1953. So fortification is not a new idea globally, not a new idea in India, but unfortunately it is not picked up momentum and reaching the people who need it most. If you leave it completely to the market mechanism, those who need it most will not get it. That is why a good idea, a few years ago they started fortifying the commodities that they distribute through public distribution system, that is rice being the largest. The government started fortifying rice with iron, the folic acid and B12. I think this is very, very important and it will eventually be a highly impactful intervention, and this is picking up and it is already making a difference according to new studies.